when we look at the circulatory system, we're going to be talking about blood vessels. And the blood vessels are defined as to how they are transporting the blood in relationship to the heart. So is the blood being pumped away from the heart, or is it returning to the heart? And so when we talk about arteries, by definition, these are blood vessels that carry blood away from the heart. Now, you might remember that there are some arteries, or there is specifically one artery in the adult that transports oxygen-poor blood. So in most cases, arteries are red in the diagrams, but the pulmonary artery is special because it transports unoxygenated blood to the lungs. And likewise, when we talk about the umbilical artery, it also is transporting unoxygenated blood to the placenta, where it's going to actually pick up oxygen. So this is the exception. So the vast majority of arteries, therefore, are carrying oxygenated blood, and they're also carrying blood under high pressure relative to the other types of blood vessels. So majority carry O2 rich blood, hence they are red in the diagrams. And they're carrying blood under high pressure. They also have a pulse. And so when you feel your blood vessels that have pulses, like under your neck, like your carotid or your radial, that means that the blood is pumping through under high pressure, and it's actually causing the blood vessel to expand during the ventricular contraction, and then during diastole of the ventricles, where the ventricles relax, then the you feel no pulse, right? So it expands and kind of contracts. We also have in our blood system, in our circulatory system, veins, and these are blood vessels that carry blood back to the heart. Most of these are blue. They are carrying unoxygenated blood, except for the pulmonary vein. So the pulmonary vein transports O2 rich blood back to the left side of the heart, so then it can be pumped out by the left ventricle out into the systemic circulation. We can also say that when we talk about veins, they are carrying blood under low pressure. So this low pressure is due to the fact that the blood has been transported into smaller and smaller and smaller arteries until it goes through capillaries. And then that is where we get a lot of the pressure of the blood drops. And so the veins are actually picking up blood that is under low pressure. And in the case of if you're standing up and we're talking about our feet, it's actually having to pump that blood against the gravity back to the heart, okay? So the pulmonary and the pulmonary vein transports O2 rich blood, as does the umbilical vein. And it is carrying blood under low pressure. So we'll talk about several ways in which veins have specific adaptations, structural adaptations that allow for a more efficient movement of the blood, because there's really no pump to the venous system like there is to the arterial system.